India has achieved a 75 crore vaccinations milestone. It's an important milestone given that we need to keep up with the pace. We need to inoculate the entire population very, very soon. By the end of the year is what the government of India has promised. To talk about that and to talk about the pandemic, by and large, I have with me Dr. V.K. Paul. Thank you so much for your time. You've been the most definitive voice when it comes to the pandemic. You've been handling this from the word go from day one. First of all, your thoughts on the 75 crore vaccinations milestone, and also do you think that right now consistency has to be the key?
Thank you so much for the opportunity. Yes, the milestone of 75 crore vaccinations having been administered to our people is truly a milestone. It's a tribute to Swatantrata Ke Amrit Mahotsav, the 75th year of India's independence. It is a small but a significant tribute in that direction. Yes, indeed, consistency has to be important, must be important as we go forward. Only then can we achieve the universal coverage of all the eligible population with the vaccine as we have set out to do, and we are doing well. We can see that the pace of vaccination is increasing from about 20 lakh per day in May. We are now inoculating something like 75 lakh per day. So clearly there is an acceleration, and this has happened and has been achieved with the fullest cooperation of the people of India, the district teams, the grassroots teams, and the state and the union government. It's a collective effort. And we must also today pay tribute to the industry, the vaccine industry, which has made possible that this achievement could happen in India through the vaccines manufactured on Indian soil. So it is truly a proud moment. Yes, there are many more miles to go, but I think it is well within our grasp to move in the direction of achieving the goal that we have set out for ourselves to protect the Indian people, India as a nation, from the onslaught of this pandemic going forward.
What is the kind of vaccine hesitancy that you're still seeing amongst the Indian population, both urban and rural?
Well, at the moment, the overall balance is vaccine acceptance and eagerness. As you know, the pace has been picking up, so people are accepting vaccines, and that's how this is the status right now. But going forward, if we have to reach every adult individual, every eligible individual, then we have to make sure that people do accept the vaccination. So they need awareness, they need confidence that the vaccines are safe and effective and useful, and they protect themselves. And also it is our duty that we make access to vaccine easy, because I may be interested in taking a vaccine, but I must know where to go. And when you're looking at the heartland of India, the front line down to the community in every nook and corner of India, this expectation has to be met by the interest created in the individual and the ease of accessing the vaccine. Reaching out to those communities will be very important, and therefore extra effort would be needed as we move into future.
What about the approval for Covaxin by the World Health Organization, the emergency use listing?
I think very significant progress has taken place. There are positive signals from every quarter. We believe this could happen in the next few days, maybe a couple of weeks. And we are constantly engaged with the World Health Organization. We know that with data being provided by Covaxin, it is being respected hugely, and we are on track for an early licensure.
You're expecting the authorization to come in by September, the end of September?
Well, this is, we have been in touch with WHO, as you know, that they had stated somewhere mid-September, and I think they are on track for sorting this issue out. And therefore, let's hope that this month WHO will take a great decision, a positive decision, and well-deserved decision in favor of licensure for our vaccine, Covaxin.
So, there are other vaccines also that we've spoken about, but where are those vaccines is my question. Pfizer, BioNTech, Moderna, we already had Cipla talking about getting it to India. Where is this conversation getting stuck? It's just that, is it an indemnity issue? Or is this something else that Pfizer is expecting out of India, which India is not in a position to give?
On this issue of the three vaccines, the Pfizer, Moderna, and J&J, these are foreign-made vaccines for which, in certain ways, offers are there for India to receive. We are examining those issues. It is not about one particular aspect. It is the entire package, which includes issues such as indemnity. It also has, contracts that are related to supplies and conditionalities and so on. And it's being looked at in totality, and we are in dialogue with all the three manufacturers.
What is it that they're insisting on?
I think it's not appropriate for me to bring that up here. All we can say is in the national interest, the discussions are moving to create a concurrence and consensus between the government and the companies and find a way forward.
Also, when it comes to different states, what are those three things that you would want states to do to improve the vaccination drive for it to pick up pace?
Firstly, I want to actually congratulate the states for the way they have done. As I said, the speed got picked up from about 20 lakh per day in May to 75 lakh per day rate. But I'm also very happy to share with you that overall today, in fact, there's another milestone achieved today. And that milestone is more than 60% of India's population is now recipient of one dose.
One dose.
And from the tracker data that we shared with public, that even one dose has a protective efficacy for mortality to the tune of 96-97%. So this is already a big shield to India against the onslaught of the pandemic. So we should be proud of this other milestone which has been achieved.
Sure.
And national average being 60%, I'm pleased to tell you that 15 states and union territories are this coverage of 75% and more. Right? And you of course know 100% for Himachal and a couple of union territories. And if you bring it down a little bit to 70, then it is also Assam, last date, Assam, Delhi, Karnataka, Rajasthan, and so on. And likewise, even for 2 doses, there are 14 or 15 states whose coverage is 29% or more. And it also has last states like Gujarat, Delhi, in terms of population, and Kerala and Himachal and so on. And with increasing availability of the vaccine, the supply side would look even better. Yes, we have a little imbalance on males versus females. 47% females, 50. It's this inequity occurs as such in our country in many ways. Actually, thinking of this is actually not too far. But then I think we should get more women to come. We should get more pregnant women to come, and I think that should be a message that media and all of us should work toward. The access to information could be a problem. Comfort with which women can go and access the vaccine can be facilitated further. So such inequities, if any, should also be corrected, and that's the next challenge. That is, the challenge that we will now all together, put together, will face.
What's the conversation about booster doses in the country?
The conversation in regard to booster doses again should be based on science. We do not really have true data that says that after a certain period of time there is a need for a booster. It is not only to be based on antibodies, it is also to be based on the T cell response and the memory cells, because they will invoke the response. Antibodies are bound to decline with time. That's how the humoral immunity is supposed to behave. So if you say, do we know for sure when to give the booster vaccine? We don't have a pakka answer. If you say how many doses, etc., we don't know. And then since we are using different vaccines, do we know for each one of them what to do and when to do? The answer is again evolving science, and we should respect that. Having said that, we are again happy that the Covaxin trials are going on the booster. And let's wait for those scientific data to come. Other scientific data from other vaccines is also evolving. As I said, definitive answer to this question based on science does not exist. And therefore, right now our focus should not be really to start talking about boosters, at least now. No need to talk about it. Push the 2 doses of the vaccines that are there in the system. acquire the immunity, and push the science. And once
Sure.
the science states that there is a need for this, this will be taken care of. Even today, WHO doesn't have a definitive recommendation on boosters. So hold on. Our discourse and our effort.
Dr. Soumya Swaminathan has said that it appears that in India, this infection is becoming endemic. What are your thoughts about
Well,
achieving endemicity?
Dr. Soumya has clearly pointed out possibility of how the pandemic would pan out, right? Again, as we said, among the things that we don't know is the true epidemiology or future epidemiology of the pandemic. Now, it is possible technically that this pandemic may disappear just like the SARS is gone with the wind. It is also possible that it may go to such low level and then it simmers around as an endemic disease, which we will protect ourselves with vaccine, hopefully some drug, and hopefully without masks, or if required with masks and so on. So it's a low level, and then we keep taking annual vaccines and so on. Another possibility could be that the pandemic will go at a lower level, and then when the variants come, there could be an excursion
Wave.
in some area or some locations and so on. The short answer is that we really do not know how the future of this pandemic would be or could be. We hope it will disappear. We hope it will, if at all it persists, it will be endemic at a very low level, which we can deal with. And we can go to a new normal, which is not far away from the real normal. That's our hope. But as a scientific question and a question of epidemiology, truly the future nature of the pandemic is a very important question, and scientists are working on it.
Much talked about third wave. Your internal assessments, if I'm not wrong, I've asked you about this in the past as well, seem to be suggesting that we could have cases increase after the festivals. Is that something that you're anticipating?
Again, nothing definitive can be said about any future wave. As of now, we are still experiencing the second wave. We have had a decline, and then we are just about plateaued at a certain level with some perturbations from time to time. There are scientists who, using their robust models that they believe in, reasonably valid, say there will be no third wave. There are others, and several of them, who think that there could be an outbreak in the month of, the coming months, let's say. This comes from the fact that by this time there will be accumulation of vulnerable population once again to a certain level. There may be weather factors which we don't understand fully. It is also the flu season. Typically, we have had our escalations about 2 months, 3 months after escalations in Europe or Americas. So it's a conjecture of sort, or a good faith conjecture, that there could be a disturbing period coming forward. And on top, we also know that this is a time when the festivities happen, congregations happen, and so on. And therefore, we should keep very much this in mind, that the next 3 months, 4 months are very critical. To me, they are also even more critical because this is the time when we want to cover everybody with vaccine. So if we can save this nation and states and districts not having the pandemic, not having outbreaks in this period, by using all the tools, and I'm repeating that, again, when we say we want to control and keep the chains of transmission and not to have outbreak, vaccine is only one strategy. We continue to have, again, contact tracing, containment, mask wearing, social distancing, avoiding crowds, avoiding unnecessary travel, avoiding getting people collected in closed environments for another 3 to 4 months. Escalate vaccination during this period, we could see the light at the end of the tunnel.
There are many epidemiologists who have in fact said that why rush up opening up schools? We've waited for so long, even if children are not getting severe infection, but they have other manifestations like MIST, for example. Doctors have gone on to the extent of saying in Delhi that pediatric ICUs aren't ready. If there were to be a third wave, the population which is not vaccinated will be the worst affected. What do you have to tell all of them?
Well, remember, people are saying don't open the school, then there are lots of people who are saying open the schools. Remember, opening of the school, just as opening of the economy and the societal activities, will always be our hope and aspiration, right? We have now understood about the disease better than what we knew 6 months ago or 1 year ago. What we know is that in order for safe collection of people, let's say school in this instance, there are certain quote unquote preconditions. And we must look at them first and then take decisions. Firstly, the disease in the community, locally, district, city, must be of a low level, and that can be defined. Okay? In low level situation, the risk to anybody, teachers, students, and their families, etc., and disease spread becomes somewhat low. So keep that in mind. Second condition is that strive now, and that's possible, strive to have the teachers and the staff of the school vaccinated. And we have done well on that.
How well, sir?
Well, we are monitoring it, but at about 6 weeks ago, 5 to 6 weeks ago, 50% of teachers and staff were inoculated. And then the government made special efforts to direct vaccine toward teachers, giving this guideline to the state governments. Don't have the most updated data, but I think we could almost be at a very high level of coverage. Therefore, second box ticked. Third issue is to remember that we should take these decisions collectively. Take this decision with the families, local authorities, doctor, stakeholders, local communities, because it is a societal responsibility and it should be a collective decision. It should not be forced. Parents should be willing to send their children. So this is a very, and the last one is that school activity, and for that matter office activities or industry activities, has to be structured on the new normal, the new SOPs. And also such SOPs will be applicable even if we go to further low level of pandemic for perhaps the next year as well. What do these SOPs mean? It means you hold the classes if it is a classroom with open windows and a lot of open air. Children sit with social distancing. Children wear masks. Teachers wear masks. And when we talk as teachers, and so we still wear masks, like we are doing it now. Make sure that there are plenty of facilities for hand washing. Make sure that when the lunch break happens, the children are spread out. So they are not having, eating with having removed masks and risking themselves. It would also mean when the children come in the morning, you ask a question. Are you okay? Is your family okay? And if you have, a positive signal to say that somebody is unwell or you are unwell, this child is gently sent home as not mixed, right? Similarly, you encourage children, and through children, everybody, that their parents should take the vaccine. Because children protection today is safety lies in having parents vaccinated. I said that. As also teachers vaccinated. So make sure that now vaccines are available, so they take these vaccines. And then there are protocols with regard to when to do the test in a child should there is a need. So those things should be available. Activities should be open-ended. You could stagger the class. So there are ways of doing it. The point I'm making it that you play by the rules, enforce discipline by the school, by the teachers, by the family, by the students. And through that new normal, conduct teaching in a safe manner. So it is conditional to situations. It is then, once you do this, then the benefits of doing this outweigh not doing it. Okay?
Sure.
Because then you tilt it in favor of an opportunity for children to learn and catch up. And also it's not catch up only about studies, by the way. It's also about interaction with other individuals, societal development, your comfort, your loneliness. All those aspects are taken care of. So I would say, yes, there is a way forward, but these decisions should be taken holistically, keeping these fundamental pillars of advice that we talked about. These are again universal. They'll be same here and in Europe. Stick to them, enforce them, be together, do it as a collaborative activities, but don't open it for the sake of opening. please, because that could be risky. And we would like to salute the teachers who will take part in ensuring such a new normal in schools.
So, pediatric ICU's preparation, and also I want to talk to you about...
Huge preparation is taking place for pediatric ICUs. I have figures I can tell you, with thousands and thousands of pediatric ICU beds are being created. Pediatric ventilators are being created. There is a very special effort through the special grant of the union government. Those efforts are being made. There is a center of excellence in each state. Then there is a network of institutions which will provide dedicated services for children. And so that's being carefully orchestrated as a part of our overall preparation. Let's hope there will not be such a need, but you must remember that yes, we are seeing a slight increase in the proportion of children who are turning positive as a overall cohort, but we are also finding that the mortality is actually on the lower side. But there is no need for complacence at all. We have to be prepared. We have to be prepared for a lot of headroom. So we may expect these number of cases, but we have to be prepared here, and that is the work, the way the union government is working with state governments.
Is it because of general opening up also that children are getting infected now?
Well, I think the children are coming out a little more often now. There is more awareness that children could have infection. Earlier, you may not have been testing them. Yes, it's possible. The awareness part may be there. And also because the adults are, higher in seropositivity, that means exposure, this remains a vulnerable group. So vulnerability is a little bit high. But there is no need to panic.
Sure.
This is under control. And I gave you example from Kerala that the mortality is actually less, even though the cases are slightly more. So let's watch the situation systematically. You haven't heard from, most nations, the situation has been explosively bad against, in terms of severe problems with childhood COVID. But keep a watch and be prepared.
Dr. V.K. Paul, thank you so much for your time here. So you heard from Dr. V.K. Paul on the pace of vaccinations and what India aims to achieve complete vaccination for the entire adult population. Yes, he says consistency certainly is the key here.